Okay, well, thank you very much. If we can get my slides loaded up. So all of us here at the table, and I know many of you have participated in research, and we do spend a lot of our time thinking about prostate cancer and people and their families with prostate cancer and how we can help make that journey better and help people move on with life, hopefully after the diagnosis and after they're cured. We only have about 8 minutes or so, and this is something that we could probably talk about for a few hours at least, and I know there'll be a lot of other talks coming up on this subject. But I think we were asked to speak about this because I think that prostate cancer patients, the Prostate Cancer Canada Network, Movember, etc., has been very involved and very encouraging of research in Canada on prostate cancer. And I want to start by saying that very much our initiative is patient-centered. And occasionally you hear people say, well, I don't want to be a guinea pig. And I get that. But for the most part, I think people understand, and certainly we understand, that this is not researchers doing research on patients. It's actually a partnership. And my experience has been that people, my patients and all of our patients, are very much wanting to participate in research, and it's incredible to me how selfless patients and their families are with their time and their attention, and sometimes with the uncertainty that goes along with research. I've broken down research because often people, when they hear about research or trials, they are thinking only about new treatments or a search for a cure, and certainly that is a big goal of ours. But research can't only be that, because we have been trying to cure prostate cancer and other cancers for many, many years, and we hope to get there for certain, but I think it will be a little while. And in the meantime, I think it's important that our diagnosis, prognosis, estimation of what a patient is going to experience, certainly the current treatments we have, like robotics, and I think Dr. Morgan will speak about radiation, and Dr. Cannell on medication treatments. These are all important that we make them as good as possible, not only so that they are effective, but also so that patients can have the least impact on their quality of life as possible with those treatments. And I will tell you, because around 2004 I was still training, there was almost nothing we did for patients that was different between about 1990, or even before that, to 2004. You could read a textbook from 1990 and essentially everything was the same. But now when I reflect on our current practices and how we currently evaluate and treat prostate cancer patients since that time, almost every single thing from diagnosis to sort of end-stage management has changed. And certainly our understanding of this disease has changed significantly in that time. And if you look at how innovation occurs in almost a exceedingly accelerative way, I think probably in the next 5 to 10 years we'll see another evolutionary leap. And all of these changes are driven by research that we do with patients in a partnership. So I want to speak about a few of these things that we're doing here in Ottawa that I think will be of some interest for you guys. A lot of you will have heard of some of the research that's being done in oncolytic viruses or cancer-fighting viruses. And we have experts in Ottawa, basic science experts, who really are leading the way in the world. And currently in Ottawa, we are doing some of this work where we are manufacturing viruses specifically to attack prostate cancer cells. And an observation many years ago was that in some cases, viruses tend to infect cancer cells more preferentially than our regular body cells. And if we can specifically hone some of these viruses to attack prostate cancer specifically and leave the rest of our cells alone, that could be a major leap forward in a new treatment paradigm for prostate cancer. In Ottawa, we are actually leading the way in this. So these are our first 10 patients where this is an example of surgery that Dr. Morash just showed. 10 patients that I operated on with high-risk cancer. We took out their prostates. We took samples of their cancer right in the operating room. We sent them to the lab where we tried these new viruses that have been manufactured in Ottawa to see if we could infect these cancer cells with the virus. And the graph on the right-hand side shows that in almost all of these patients, the virus preferentially infects these prostate cancer cells. So these viruses are currently being manufactured here. We think that this will be in clinical trials being used in patients probably within the next 2 years. So this is not far in the future. This is going to be done very soon. So in terms of research into diagnosis, this is a study that we are participating in where patients have the opportunity to better evaluate where the cancer cells could be. One of the limitations we have had for many years is trying to identify where cancer is within the prostate itself, or if it is spread, where it is there. And Dr. Lavallee will be speaking a little bit about that later. So for many years, all we had was an image like this on the left, which you can't really see much. I can tell you, because I know how to look at CT scans, that the prostate's in here somewhere, and here's the rectum. But I could never tell you in there where the prostate cancer might be. So this is a trial that we're currently doing in Ottawa, where patients are given a novel type of CT scan where we use a medication that binds to proteins that are on the surface of cancer cells. And when they bind to those proteins, the cancer cells will release a bit of radiation or a signal. And that's represented by the yellow and red here. So in this patient, this was done about 1 month ago. We gave this drug to the patient. We did this scan. Before surgery, we saw that there seemed to be cancer in this one area of the prostate. So when I removed that prostate, I paid special attention to making sure all the cells were removed on that side. We then send the prostate to the pathologist, who looks at it in extreme detail and corroborates what we're seeing on these X-ray tests. So we don't know if this is going to work. It worked in this patient, but we don't know if this would work in all patients. But if in these trials we find that it does, then that becomes a new standard of care. And when I'm giving a talk like this 10 years from now, this will be one of the next paradigm shifts that I'll be speaking about. We also believe in this saying, and this is something that I think really hits home with patients. There's a saying that a rising tide raises all boats. And when it comes to cancer care, it may depend on who you see or where you are seen that may dictate a lot of the care that you're able to receive. So if you are seen in Callowit or downtown Ottawa or downtown Toronto, the care, as you can imagine, could be different because of the level of expertise or technology that's there. But even within our region, the Ottawa region, there could be some variability in care. And one of the main aims for our research is to try and reduce that variability of care so that every single patient has the same excellent quality of care in terms of their diagnosis, prognosis, treatment, and survivorship afterwards. So this is another Ottawa homegrown research study that we're doing. We call it the SIRRUP. So it's not maple syrup, but it is Canadian, but SIRRUP stands for Surgical Report Cards. And this is something we've been doing for the last 2.5 years or so. And it is an excellent example of how engaged patients are in the Ottawa area to be involved in research. So these patients were evaluated prior to treatment, so at the time of their diagnosis, 6 months, 12 months after their treatment. And one of the unique aspects about this type of research is we're not only collecting cancer research, we're actually asking patients to provide us feedback about how they're doing. So it's called Patient-Reported Outcomes. So you are telling us, I'm having this issue with urination, I'm having this issue with maybe sexual function or with overall quality of life and performance. And we combine all of this information, cancer information, but also subjective information back to patients. And we collect all of this information and we provide that feedback back to all of the surgeons who perform prostatectomy in this example. So in 2.5 years at the Ottawa Hospital, we've had 550 patients who have participated in this study, which is about 98% of all patients have participated. And one of the things that we see quite often in research is that over time, people are like, oh yeah, that surgery was 6 months ago, I don't want to be doing that anymore, I'm just going to go on living my life and want to kind of forget about this. But what we have found in Ottawa is that patients are very engaged. And these numbers are actually extremely high. 90% of patients have complete engagement and follow-up by 6 months, and 86% of patients by 12 months. And that is really remarkable, and that's the type of engagement that we just don't often see in these types of research studies. This is what a surgeon would receive. So every 3 to 6 months, a surgeon would get a report card, and they would see how their patients have done overall and then over time if things are changing. Not only can they see their own patients' outcomes, but they also get feedback of how their patients are doing compared to all of their colleagues. So we can make sure that everybody is receiving an excellent standard of care. So for example, this would show margin rates and where margins are positive or negative, and we can use this information to counsel our patients as they come up. So when we talk to a patient about the risk of cancer recurrence, when we talk to patients about what they can expect for urinary and sexual outcomes, we can provide patients not with the average across the world, but the average in their actual patients themselves. These are some of the things that we can do. So this is looking at margin rates, so a cancer type outcome, and it looks at over time how things are changing. So we have built a platform that we can try new therapies to see if that impacts patients' cancer outcomes. We can see if it impacts patients' quality of life outcomes. And this is an extremely powerful tool that we have developed that will allow us to get better and better as time goes on. So I think what the message I want to leave you with is that research equals better care for patients. Research is patient-centered, and that is always our goal. Our questions relate to questions that we have in the clinic when we see men with prostate cancer and ways that we can try and make it better. Research isn't only looking for new cures, although that certainly is a big part of what we are trying to achieve. It is all of the other aspects around it. I think most patients do not feel like guinea pigs. I think they very much feel like partners in research, and I'm happy to share some of the work that we were doing today. Of course, it's just a brief overview, and I just, on behalf of all of us here, want to thank you all, many of whom have participated in research at the Ottawa Hospital, for your support and enthusiasm toward it. Thank you.